it's tricky because these brain injuries often have this diffuse impact, so they're actually really affecting those connections to different areas of the brain, although if there's a specific kind of insult to a specific area, those functions might be more affected. And I don't know if you wanted to add a little bit more on that.
Absolutely right. So there could be an effect, sorry. So there could be an effect of where the location is. But for young children, you think even more particularly than for older children, and certainly than adults. First of all, those skills aren't as localized. Those connections are still developing. The other thing is that, part of the reason we used to think the younger children were actually more resilient was because the brain is plastic, particularly at that age, and will kind of rearrange to try to compensate for some of those lost skills. What we've discovered, though, is that rearrangement isn't necessarily helpful, okay? So that some of those skills might move to another part of the brain or be localized in a different area if a particular area of the brain is impacted, say language, okay? But the problem is then those skills move into an area of the brain that was supposed to be used for something else, right? And so a lot of times it's really tricky for little kids to think about localization. And so adult neuropsychologists who do the kind of work we do, you'll see a lot more talk about location of injury because adults' brains are a little bit more crystallized. But for little kids, we tend to focus less on localization and more on function, if that makes any sense. Yeah. Did that answer?
Yeah. Okay. Yeah. Right. And we had kind of previewed this. Oh, yeah.
Another thing that I think, I guess my question is, with children with shaken baby syndrome that I've seen, one thing that I've noticed with that, it seems like it's not localized in that there's no pattern of where their delays are. Mm-hmm. Like if you have a child that, for example, had cerebral palsy, which was before birth, you can kind of estimate, if they struggle with this, then it's going to serve a pattern, and their strengths are in another area or something like that, and it's going to be a pattern. But with children with shaken baby, it seems like there's no pattern to it. Is that correct or not?
So, I don't know that I'm an expert in shaken baby, but I can kind of think about this. Sorry, I need to stop turning this off. I'm going to turn it back over. Okay. So, but you can kind of think about this in terms of what we've learned so far and what you kind of know. So shaken baby, first of all, these are really young infants, right? And second of all, the injury itself is pretty diffuse, right? So, in shaken baby, what you're looking at is lots of that microscopic kind of injury, right? Because the shaking involves a lot of that twisting, right, and shearing motion. So one issue is that you're probably going to see more global impact because of the age range, right? And then the other issue is probably the nature of the injury, although, again, I'm not an expert in shaken baby, and I'd have to look at that a little bit more. Does that make sense, though? Yeah, so what you're thinking about is that unevenness of strengths and weaknesses that sometimes you see in older kids who had an injury, right? And you're not seeing as much unevenness in those kids, and that's probably why, is the more generalized nature of their injury and also their age and injury. Yeah.
Yeah. I'm sorry, but I can
Yeah.
Yeah. The brain injury has to be physical or can be emotional?
Well, here we're talking about a physical injury that happened to the brain. What kinds of more emotional injuries are you thinking of, like kind of traumatic events?
Exactly.
Yeah. You can certainly see some of these sorts of problems in kids who've experienced something that's psychologically traumatic. But what we're talking about today is more about physical injury to the brain resulting in some of these problems.
And that's where I think things become complicated, and where we sometimes can be helpful as psychologists is sometimes it's hard to pull those pieces apart, right? We have kids who've been injured and also have trauma, and how do you know what part is what? And we can't always pull that apart. I mean, we're not always able to pull that apart. There was some recent research just out in the last week or so about the impact on the brain of traumatic events, right? And so we all know that experiences certainly affect the developing brain. But we can look at the patterns that the child is showing and get some idea of what the different contributing factors could be and how much of a contributor an injury might be. Yeah.
Then just to talk a little bit about, we were talking about how kids were doing academically, and we've already kind of alluded to this about how they might be doing socially. What kind of social issues that are either on the slide or other ones that you might think of, might you think some of these kids would have, given the kinds of cognitive issues they might have, the sorts of emotional issues that they might have, some of the behavioral issues that they might have? How might that play out in terms of their social interactions? Need art.
Frustration.
Yeah.
Makes them have to get attention in another way.
So they might get frustrated. They might not be able to express themselves real well, so they might tend to act out more than another kid might. So it might kind of manifest in problems with aggression. Yep, absolutely. How about those?
A lot of confused.
Yeah.
Brains,
Yeah.
Because they want one thing, but later they change and they don't know what they want.
Okay. Yeah, so feeling a little bit kind of confused. The other thing to be thinking about too is remember that part about the communication part, the nonverbal communication part, and the social information processing. If some of these kids are having trouble just interpreting information from the social world, interpreting what it means when somebody's voice raises or when their eyebrows kind of go together and they look like they're not happy, if you're not understanding some of that effectively, how do you think that might play out in terms of how you come across to other people? If you're missing a lot of the clues you're getting, what happens? Kind of seem, yeah.
Not acting appropriately.
Yeah, you're responding kind of off, and then you're probably not getting very good feedback from other people because they're not really sure where you're coming from. So these kids might tend to be, might have problems with loneliness or being left out, that they just kind of can't keep up socially.
Might seem defiant.
Yeah, they might seem defiant when in fact they're kind of confused or they got a little bit lost. Yeah. Also with the impulsivity, one thing that people might notice is sometimes these kids will kind of blurt something out or talk out of turn or that sort of thing, and it's more of an impulsivity problem. It could also be a defiant problem, but it may not necessarily be, but it might get interpreted that way. Absolutely, they might kind of, talk or do before they act, and without intentional consequences. They're going to have more trouble with solving social problems. Sometimes they might come across this way. They might come across as bossy. They might not realize the effect it's having on other people. Plus, there's been so much that they haven't been able to control. They might be trying to do their best that they can to control the situation. We're going to play this way. You do this. You say this, then I'll do that. That kind of thing. That doesn't tend to go over real well. That's not going to build your popularity or make other people want to hang out with you. On the flip side, some of these kids could also be a little bit more vulnerable to being kind of gullible or suggestible and kind of following the crowd. And this is kind of what happened some for Adam. Adam actually had a lot of social strengths, and he did okay socially for the most part, but the one worry that his mom has was kind of more about this, that he tended to be more of a follower, and she worried that over time maybe he'd get in with kids that weren't a good influence and that he might not have the strong judgment to kind of make a decision about whether or not it was a good idea to keep up with them or to kind of bail out of that activity. But you can see a mix of different sorts of social issues that stem from these other problems with behavior regulation, emotional regulation, and all those cognitive areas. And along the same lines, what kinds of problems might you expect just for kind of day-to-day practical living skills, like your ability to get up in the morning and get yourself dressed and ready for school? Those sorts of things. What kinds of issues might you anticipate there? Just being able to get your stuff done.
The slowness that you mentioned earlier.
Yeah.
It takes more time to get it.
So basic stuff, might just take more time. Like just getting up and getting dressed might take longer. Absolutely. All right.
They might not know how to sequence the events.
Yeah.
To get ready.
Absolutely. So
First.
Yeah, some of those organization problems might get in the way of kind of doing things out of order or losing pieces, remembering to do, when you're taking a shower, remembering to, remembering some parts to wash but forgetting to wash your hair or that sort of thing. Yeah. What else might you see?
You probably argue more.
Yeah, absolutely. That's definitely one thing that you can see. And so part of that's having a little bit less of a strong filter. And also some of the frustration that can build up. Let's take a look at this next one. Yeah, so there can be lots of different problems in just kind of practical day-to-day functioning, like you guys mentioned. Just basic stuff might take longer. Because of some of the physical and cognitive problems, a child might need more help with some basic kind of self-care, getting ready, getting dressed, hygiene type issues. Or just because the speed issue might slow them down. Also, we had talked about some of the there might be some clinginess or dependence or some anxiety. The child might just want more assistance, even if they don't, physically need it. How about when it comes to safety and just kind of judgment about how to operate when you're out in the world? What would you be worried about?
They'd be very vulnerable to others. And poor judgment.
Yeah. Yeah, so you might be vulnerable about the influence of other people, maybe trusting people that you shouldn't. What other things might you be worried about of just kind of basic, kind of personal safety type stuff? Yeah, yeah. You'd be worried because of impulsivity that maybe you wouldn't look both ways. Maybe you just kind of run off. And that's something that happened for Adam, something his parents were worried about, that as soon as they pulled the car over, he'd just kind of jump out and go without looking around to see if it was okay to do that. So there could be some worries about personal safety skills. Also just things about kind of, knowing what do you do if there's an emergency and you need to get help, and who do you call, and those sorts of things. There might be some concerns in that area. And also just kind of basic self-direction about being able to think through what are the things that I need to do and what steps do I want to do them in. So things like, chores, cleaning up after yourself, or doing the laundry, or making sure your homework's done, or those sorts of things. Because of some of those executive function, those organization problems, and those planning problems, a child might need some more help and need some more structure in those areas to get through that stuff. You might find that maybe, whereas they could kind of entertain themselves for longer before, or kind of figure out the things that they needed to get done, they need more reminders and more prompts to do those things. So let me kind of stop there, because we'll move into talking more about the sorts of things you can do to support these kids given these problems. But let me just stop and see if there are any questions about the sorts of problems and any aspect of functioning that a kid might have after a TBI.
Would there be like a lack of focus?
Certainly. Yep, that would go along with some of the attention problems. It might be real hard to keep your focus on something for long enough to finish it. Absolutely. Mm-hmm. Any other kind of thoughts about some of the impacts, the cognitive and the behavioral impacts of TBI?
Another one I'm wondering about is children that we see that can't get engaged in play. They are, they flip from one thing to another instead of getting real involved in doing that scaffolding and some of those kinds of things. Is that something that you would see? Probably?
You might. And the things that triggers for me, there may be kind of a social skill problem there about knowing, well, how do you invite someone to play, or how do you get started on something? There could also be an executive function part of one executive function is being able to initiate a behavior, knowing how to get started on something. And that could be a play activity, or it could be a homework assignment, or knowing how you start when you need to sort your clothes into the dirty and clean pile. So there could be a problem with getting started. There might also be a social problem about being able to, if I want to play with someone else, how do I do that, or what do I say? So that's something you might see. And of course, keep in mind, as I'm sure you're already thinking, a lot of these problems aren't specific to a brain injury. You might see them associated with other sorts of problems that kids have. But that example could be something that you could see in a kid who was affected by a brain injury. Any other thoughts about some of the impacts and some of the problems that you might see? Okay. So we'll move into the next piece of some of the things you can do to help to help support a child who's had a brain injury. And first, just as a couple of framing comments, I think an educator's role is really an integral one. What we see when we, in terms of the research and just clinical evidence too, when you follow kids over time, what really helps them is when everybody who's working with them works together as a team and collaborates and shares information. What tends to work less well is when a kid is going to occupational therapy and physical therapy and working with the psychologist and seeing the doctor and going to preschool and nobody knows what anybody else is doing. What tends to be, because one thing that's actually really hard for these kids sometimes is generalizing what I learned here and doing it over here. So it's really important, and sometimes the educator is the one who's pulling all the pieces together to figure out, okay, what are some of the things that this child's working on in terms of communication skills? What are some of the occupational therapy skills that they've come up with? What are some of those memory strategies? And how can I make sure, remind the child to be using them here, or kind of reinforce them for using them here? So that's a real important thing. And we see that, and the research supports it too, that when everyone's really collaborating and all the players know what everyone else is doing, and prompting the child to use all those strategies and everything that they're doing, that's when they really tend to benefit the most. When it's just going and doing this in speech therapy twice a week for 30 minutes, it's not always generalized as well. So when you're able to work with these other providers and pull in those pieces, these kids do better. And sometimes it is someone in a school program that can be in the best position to be kind of the point person for that. Of course, it's a big responsibility, but sometimes that makes the most sense. So the collaboration is really, really important, and certainly collaboration with parents as well. They're going to know their kids the best, and they're going to notice a lot of things, and to keep it in really close contact, that you're telling them what you've noticed and they're telling you what they're seeing at home, that's going to be really important. Also, as an educator, you're in a really good role to have a real careful eye on these kids. Really, the message I want you to take home about what can happen after a TBI is that there's a lot of variability. It's going to depend on a lot of different factors. And there might be problems in some areas, but not in others. Some problems might pop up later that weren't apparent initially, and some problems might get better pretty quickly too. So there's going to be a lot of variability. So if you're seeing this kid pretty frequently in like a real world context, you're going to be able to give real valuable information to the parents and also to the other treatment providers to kind of let them know how they're doing, what you think's going well, and what you're kind of worried about. And you're also in a good spot to be able to introduce some accommodations and supports, and we'll talk about more specific ideas in a minute. And certainly parents play an integral role, certainly, of also being able to see this child every day and being able to pay watchful attention for changes, things that you see that are going differently for this child now than they were before the injury. Again, it's really important for parents to be communicating with all the providers and letting everybody else kind of know what's going on, so that there's really a treatment team working together. And parents are clearly going to be the strongest advocates for supports and services for the child. So kind of speaking to a parent of a child with TBI, I think the main messages would be to be kind of watchful about any changes and any concerns that you have, and to keep in mind that this child really may need some supports and some services at school and in the different activities that they're doing. So for instance, you might need to ask for an educational evaluation to see if there's eligibility for services, those sorts of things. The parent's going to be the strongest advocate for the child. And this last point, that it's really important to be attending to how the child's doing, but also to be attending to how the whole family is doing. And there I want to take you back to when we were talking about how big a role environmental factors play and how well this child's going to do. If the family's really struggling, if they were struggling before, if they're struggling to adjust to the changes that have come in after this injury, then the child's probably going to do worse. So it's very important for parents to be thinking about how everybody's doing